Hi, I'm Flo Barber-Hancock. I'm a licensed massage therapist. I am also a Ph.D. in neurosensory rehabilitation. I'm the Director of Education at Hancock CranioSomatic Institute. We teach continuing education classes for healthcare providers, and our focus is on holistic evaluation and also cranial treatment techniques that are structural with long-lasting results. Today we're going to be talking about some tips for working with overuse and repetitive motion patterns. The common problem, many of us treat these in our clinic, and also it's a very common problem among many body workers because of the repetitive nature of our work. First tip I want to talk about is a thorough history. I'm going to invite Jerry in. I've already done a good bit of history with Jerry this morning, talking with her about her repetitive movement concerns, areas where she's having pain and dysfunction, and how those are being treated. The focus is on her right shoulder and right arm, and we're looking today to see how else we can assess that and maybe get a more holistic picture of what's going on with her body. I've asked a few outside-the-box questions to try and bring out things that maybe did not come out in other discussions of her disorder. And one of the things we picked up is that whereas her problem used to be in her shoulder, now she's also feeling some discomfort in the hip. So if I can have you, wait, standing first, please. Okay. I'm going to use some muscle testing off the cord there. All righty, if I'm going to do a little testing with you here, let's have you hold this arm. Hold. Okay, I'm going to do a little therapy localization here. If I touch here, that's good. If I touch here, that's good. If I touch back here on your left shoulder, that's still pretty good, but I'm feeling some weakness there. I'm looking for areas where the muscles are not fully engaged. If I come over here, hold. Whoops. We've got a problem with the muscles over there, don't we? Hold. And a problem there. Hold. Problem down here somewhat. If I ask you to turn this arm in, hold. The muscle is strong there. If I ask you to turn this out, hold. Here we go into some hidden factors. And let that arm relax. And I'm going to touch down here on the right hip, and it's weak down the leg. Okay, let's have you down on the table on your back, please, Jerry. So although the problem has been her shoulder, I'm looking at all the different joints and seeing what other areas may be involved. I'm looking for those silent things. In some cases, the patient is not even aware yet of areas that are a problem. Here I could see that by having the arm internally rotated as against externally rotated, we found some change in the patterns. So I'm going to ask you to internally rotate your arm here, and I'm going to come up here and do a little work up here. Here I'll be using facilitated pathways therapy. This is work that I developed as part of my dissertation. And I would typically spend some time working across the forehead here because it's going to be affecting the neck and trapezius muscles. I'm going to come on down to this area because I specifically want to do some work for her elbow. And I'm going to work here a little bit behind her ear, which is specifically a treatment zone for the elbow in the mapping I've created, and also some on her ear. The ear is for the complete forearm. And this is often very tender. A little bit tender there, Jerry?
Yes.
Okay. And this might need to be worked several times over several sessions to relieve the tension in the forearm. Okay. So tip number 2 was to look for those hidden factors. Number 3 is to really look widely. We think about the elbow as an isolated function, but it doesn't work without the shoulder. The shoulder doesn't work without the trapezius muscles, which come up into the neck. When it comes up into the neck, we're involving these attachments on the occiput. And we're also affecting the SCM muscle as it comes up the neck and also anchors on the temporal bone behind the ear and onto the occiput as well. So arm affects leg, knee, and elbow relate to each other, wrist and ankle relate to each other, and all of that relationship comes on up the body, continuous fascia, and muscles that link to each other and other functions through the joints and on up to the head. And if you're not really doing some therapy on the head, then you're missing the attachments of these muscles that are on the occiput and between the occiput and the first and second cervical with those little suboccipital muscles that are really very, very important in how the body balances the head on the neck and how the body keeps the eyes level with the horizon. Those are very important for posture and overall function. Muscles have to keep us upright against gravity, and they do that by maintaining the balance at the head. Okay. And then at the end of treatment, I always like to come back and test muscles. I tend to use muscle testing. You can use other methods to make sure that your patient is back in a neutral position at the end of therapy. Really be sure you're looking at all the joints. Problem may have started in the wrist or the elbow, but the ankle, the knee, and the hip can also be highly involved in any repetitive motion. Gait pattern is an innate pattern. We learn it when we crawl and walk, but working patterns are learned patterns of repetitive movement, and they can involve cross-body also. It can go from the right shoulder to the left hip and create sciatic in the left hip, for example, in a situation like this. So look at it, all of it, and be holistic in your evaluation and your treatment. My name is Flo Barber-Hancock with Hancock CranioSomatic Institute. We invite you to check out our website, craniosomatics.com. And if you'd like further education or information on these techniques, check out our schedule of classes. Thank you very much.